Welcome everybody. Once again, this is Dr. Q, your favorite gynecologist, and today we are going to be talking pap smear. And why? What is so important about pap smears? You know what? And this is your take-home message. We start with the take-home message. Every woman that has sex must have a pap smear. I repeat. As long as you're having sex, you must be having a pap smear. You know, I was saddened a couple of years ago when a 28-year-old actually got a hold of my number from someone else and reached out on abnormal bleeding or abnormal periods with pelvic pain. When I inquired and led her on to say, look, you actually need to get somebody to look down there and say what's going on. Have you ever done a pap smear? And the answer was no. Long story short, by the time somebody actually got to look down there, it was a bit too late. She got a diagnosis of cervical cancer, which has spread to the bladder. And before she could even start with her radiotherapy, she was gone. A mother of a 3-year-old. I wouldn't want that happening to any of my sisters. And I've witnessed too many deaths from cervical cancer. And the saddest thing is, it's curable if we detect it early. That's the gist. So here we are today discussing pap smears. So what's the take-home message? As long as I'm having sex, I must have a pap smear. A pap smear for you, 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 a pap smear for everybody. Yes, let's talk pap smear, girls. So what exactly is a pap smear? Alright, a pap smear is actually a small procedure that is done to take a sample of the cells that are around the mouth of the womb and rule out cancer or any abnormal cells. In our next video, we'll be talking a bit about these abnormal cells, of which maybe you may have had a pap smear result that has shown that you have a certain type of abnormal cells. But for today, to those that have been scared of a pap smear, and that's one thing that women actually do to each other. And I always say, if they say the pap smear is so painful, how painful is cancer? Is cancer less painful? I think I'd rather take the pap smear route. I don't know about you. So how do they actually take the sample? I'll take you step by step. Because when I tell ladies, please take off your panties and lie on the bed, they'll be like, I need to take off my panties? Step number 1, panties off. And then that is what you will do when you walk into the doctor's room for your pap smear check. Panties off, number 1. And number 2, you lie on your back with your legs, knees apart. And then the doctor needs to go through the vaginal canal to the mouth of the womb using a very special instrument. The doctor will be using a very special instrument, and that is the speculum. And we say it looks like the mouth of the duck. So this actually goes in through the vaginal opening, and when it goes in, we just slightly open it so we can see the end of the tunnel where the cervix is actually lying. Okay, and a brush is used to actually take a small sample of the womb. We just brush over. We don't even pinch, and there shouldn't be any bleeding unless there's some form of local trauma or infections and stuff like that. So there's no bleeding with the pap smear, there's no physical pain with the pap smear, just a small discomfort. So the sample can be taken with a brush or a spatula that is used to get those cells. Now these cells are taken to the laboratory and they are assessed or examined microscopically to to check if there are any abnormalities in the cell that are precancerous, meaning they can lead to you getting cancer in the future, or they are already cancerous looking cells. Now the big question is, when should a woman have a pap smear check? The pap smear is recommended at least every 3 years. The recommended age of starting a pap smear is usually from the ages of 21 or from a year from the initiation of sexual intercourse. And then again, if you've had an HPV DNA test done, which is human papilloma virus DNA test done before with your pap smear, then you can actually space your pap smears to even 5 years apart. And there are other abnormalities or conditions that require women to actually go earlier or more frequently for pap smears. And this is recommended yearly pap smears if you are HIV positive or you have any other condition that suppresses your immune system. 2, if you've had HPV DNA positive. Now, human papilloma virus is the virus that causes cancer of the cervix, meaning you are at a higher risk of developing cancer of the cervix if you have HPV. Now, then we require you to do at least yearly pap smears. And again, for women who actually have any other abnormal cells in their pap smear, a previously abnormal pap smear, you may need to do your pap smears yearly or even every 4 to 6 months. Your doctor will be able to specify for you the frequency depending on the abnormalities. But remember, if HPV DNA is negative on your previous pap smear, you can space it to even after every 5 years. So why not go and get one and prevent all these ho-hos and all these sad and creepy things from happening? I think it's better to be safe. Alright, now, when should one stop doing pap smears? I can tell you just 2 main reasons. 1, if you've had your womb removed completely with the cervix and it was not because of cancer. So if your womb was removed because you had fibroids before or any other reason and your womb was said not to have any precancerous lesions, no need for pap smear for you anymore, you lucky girl. And 2, if you are at the age of 65 and have had 2 previous pap smears that were normal and fine, then no more need for pap smears for you too. So those are the conditions where you can stay away from pap smears. But as long as we are young and vibey and sexually active, let's go get those pap smears done. So this is it from your favorite gynecologist, Dr. Q. Catch us again next video where we'll be discussing all the abnormalities that you will find on a pap smear and what do they mean for you. You keep well.